Deep to the limbus, there is a canal known as the canal of Schlemm. The middle coat is the choroid, which is dark brown in color, and anteriorly, choroid also covers the posterior part, and anteriorly, it is continuous with ciliary body. And ciliary body is a very short part, and more anteriorly, ciliary body is continuous with a muscular diaphragm known as the iris. And inner layer is the retina. But retina does not extend to cover whole of the eyeball. It is present just posterior to the sclerocorneal junction. So it is like just like that. Just behind the sclerocorneal junction, it ends. And the ragged as a margin, we call the ora serrata. So first layer is a complete made up of cornea and sclera. Second layer is a more or less complete, made up of cornea, a choroid, ciliary body and iris. And in the central part of the iris, there is a hole or aperture we call pupil, through which the light rays pass. An inner layer is incomplete and we call it retina. An eyeball is made for vision, and the nerve carries this visual sensation is known as the optic nerve. An optic nerve comes out from the eyeball posteriorly. So when the attachment of the optic nerve, we can easily know that it is the posterior side. And the retina has got a photoreceptor known as the rods and cones. Rods for dim light vision and cones for bright vision, acuity of vision and color vision. And in the retina, where the optic nerves comes out, the point, the area, circular area from where the optic nerve forms and comes out, it is known as the blind spot, because there is no photoreceptors are present there. 2.5 to 3 millimeter lateral to the blind spot, again just the opposite. There is an yellowish area on the retina we call macula lutea, which is full of cones and few rods. So color vision, more or less acuity of vision are more in the macula lutea. And the central part of the macula we call fovea, fovea centralis, which is more acuity of vision, more color vision. And the center of the fovea is called foveola. So it is the macula, macular central area fovea, and foveal central area foveola, where there is a maximum acuity of vision, and in the foveola there is only cones, no rods. And this eyeball is supplied by arteries. The main arteries, outside arteries, sclera, choroid, etc. is supplied by the branches of the ophthalmic artery, right? But the retina has got a peculiar supply. The inner layers of the retina, inner layer of the retina, inner layers of the retina, up to the layer of the rods and cones, is supplied by the central artery of the retina, which is a branch of the ophthalmic artery. Central artery of the retina, which is an end artery. Very important. Central artery like renal arteries, segmental renal artery, segmental splenic artery, it is an end artery. So whenever there is a blockage of the central artery of the retina, there is a total blindness of that particular eye. So important, because there is no capillary anastomosis between the adjacent arteries. But the outer layer of the retina is supplied by diffusion by the choriocapillaries, by the capillary present in the choroid. So they are saved. But there will be no vision, because the I've already told you, the inner layers which carries the vision are supplied by the central artery of the retina. So outer layer is now one by one. Sclera is a whitish in color, cover the 5/6 of the outer 5/6 of the eyeball. Anteriorly, it is continuous with the cornea. Cornea is a very transparent. I have already told you in your lecture class why it is transparent. Because the regular disposition of the collagen fibers in the substantia propria of the cornea, plus there is no blood vessels present in the cornea. But cornea has got full of nerves, so it is very sensitive. And as there is no blood vessels, no lymphatics in the cornea, corneal graft is easily not rejected. So one person cornea can be given to the other person. আগে এখন এটাতে সবাই দেখতে পাচ্ছে দেখে আর next layer গুলি will come back. So this is the eyeball. This is the eyeball. This is the fat and other fascia tasha পেছনে. So this is the eyeball. Look, it is more or less spherical, but in close inspection there is a two curvature. দেখো, this is the scleral curvature and this is the corneal curvature. Though it looks, the cornea looks black, but actually cornea is not black. We can see through the cornea the iris. What you see in your black, blue or brown, we are not seeing the cornea. Cornea is like a more transparent than a glass, so we cannot see it. So we see through the cornea the iris. The color of the iris is be seen here. So actually when it touch here, we touch the cornea. But if we touch here, we touch the conjunctiva. Because this part of the visible part of the sclera is covered by conjunctiva. But posteriorly there is no conjunctiva. Sclera is present. So if we touch here, it is the sclera. If we touch here, it is the conjunctiva. Deep to conjunctiva, we cut the conjunctiva, then we will find the sclera. But here there is no conjunctiva. So we touch the cornea. So any foreign body easily damage the cornea. And if there is any damage to the cornea, any opacity in the cornea, vision will be affected. Right? So this is the sclera, this is the cornea. ও আরেকটা বলা হয়নি। আচ্ছা, তাহলে আইবল কি শুধু এইটাই, আর কিছু নেই, শুধু স্ক্লেরা কোরয়েড না? Yes, there are so many other structures also. What are them? Number one, lens. Just behind the iris there is a circular lens which has, খুব ভালো করে শোনো, inherent tendency to become circular. সবসময় এটা গোল হয়ে থাকতে চায়, বাট ওদের টেন্ডেন্সি কি সবসময় গোল হয়ে যাব। কখন গোল হয়? যখন আমরা খুব কাছে দেখি। তাহলে যখন দূরে দেখি, should not be so circular. Then if it is a more convex, the focal length will be so small, so we cannot see the distant vision. So for the distant vision, the lens should be slightly less convex, slightly flat. Who do these things? Normally there is a tendency to lens become more convex. But we are actually, for our maximum period of time, we look for distant vision. What I am, what you, now for distant vision. So lens is not so convex. Your lens are slightly flattened, less convex. Who will do this? Then we have to know the ciliary body. Ciliary body has got three parts. From posterior to anterior, there is a circular fibrous ring we call ciliary ring. It is a ciliary circular body, ciliary ring, a fibrous structure, ring-like structure. Just anterior to the ciliary body, there is some undulating processes, about 75 to 80. we call ciliary processes. কি বলি? Ciliary processes. Usually 75 to 80 processes রয়েছে surrounding this. Just posterior to the, at the level of the ciliary body and posterior to the iris, there is, I have already told you, there is a lens. This is the lens. এরকম আঁকা উচিত নয়, একটু কনভেক্স আঁকি। This is the lens, right? This is the lens. From the ciliary body, there are very fine threads like structure goes to attach to the outer surface or outer capsule of the lens all around. From the ciliary undulation মানে কি wavy, from the crest of the, from the valleys of the, একটা পাহাড় তার মধ্যখানে ডিপ্রেশনকে আমরা ভ্যালি বলি, from the valleys and sides of the ciliary process there is a small thread like fibers which extends from the ciliary body to the lens. Lens is covered by the capsule, attached to the capsule, and behind the ciliary body there is a muscles. এই জায়গাটায় মাসল রয়েছে just anterior to the ciliary ring. These muscles are arranged, smooth muscles supplied by autonomic nerves, parasynaptic nerves, arranged meridionally, obliquely and circularly. Every direction these muscles are arranged. তাকে আমরা কি বলি? Ciliaris muscle. তাহলে ciliary body consists of ciliary ring, ciliaris muscle and ciliaris processes. And these fibers which which are attached from the ciliary process to the lens is not a part of the ciliary body. It is separate thing. And these fibers we called suspensory ligament of the lens. Normally, when you see for distant vision, the ciliary muscle remain relaxed, কাজ করছে না, and suspensory ligamenটের কাজ হচ্ছে কি? লেন্সটাকে টেনে ফ্ল্যাট করা। The work, what is the function of the suspensory ligaments? No, accommodation to at a one word term means ki when the ciliary muscle remain relaxed, they become active and makes the lens flattened, becomes less convex. Less convex means for distant vision. আগেই বলেছি, more convex means near vision, কারণ ফোকাল পয়েন্টটা কমে যাচ্ছে, তাই তো, ফোকাল লেন্থ কমে যাচ্ছে। So normally ki when distant vision, ciliary muscles are not acting, and by the inherent property of the suspensory muscle, flat হয়ে রয়েছে, and when we try to read the books, the ciliary muscle contracts. Whenever ciliary muscle contract, this suspensory muscle becomes slackened, এইরকম হয়ে যায়, ঝুলে যায়। ঝুলে যায় কেমন? এইটা কি আছে? টান টান, হ্যাঁ, ফলে becomes flat. আর লেন্সের টেন্ডেন্সি কি? should be more round, but এরকম করে আছে রান। যেই ciliary muscle action করছে, when ciliary muscle acts, it becomes this. These ciliary processes become loosened, so lens become convex. ক্লিয়ার হয়েছে জিনিসটা? যে টান টান করে রেখেছিল সেটা লুজ হয়ে গেল। মাথার মধ্যে কিন্তু আগে উল্টোটা আসে, যে টান করলে বোধহয় মোট টান হবে। নো, when ciliary muscle acts, the jonular fibers or the suspensory, the jonular fibers, the suspensory fibers or ligament of the lens become slackened. So লেন্সকে আটকেও টান করে নেই। So lens become more globular and we call it accommodation. তার সাথে আবার constricted pupil attend করে pupilটা will be more constricted, so that light, sharp light rays goes only for near light goes through the pupil to be focused on the retina, central part of the retina, close to the macula lutea. কেমন? সেই প্রসেসটাকে বলছে অ্যাকোমোডেশন। Lens become more convex, pupil become constricted, so that our eye is fixed for near vision, and the process is called accommodation, and the reflex doing it called accommodation reflex. তাহলে ক্লিয়ার হলো? এটা ক্লিয়ার হয়েছে? Both ciliaris muscle and constrictor pupillary muscle are acted by parasympathetic nerves through ciliary ganglion. আসবো আমি কালকে। আচ্ছা, এটা হলো লেন্স আছে। আর কেউ আছে কি? কেউ বলবে? সাসপেন্সরি লিগামেন্ট আর জনুলার ফাইবারস রয়েছে। আর কি রয়েছে? হ্যাঁ, ওয়াটার রয়েছে, অ্যাকুয়াস হিউমার, ভিট্রিয়াস বডি। বিটুইন দ্য লেন্স অ্যান্ড রেটিনার তো ভ্যাকুয়াম হয়ে থাকবে। So between the lens and the retina, there is a jelly-like material covered by a capsule we call the vitreous body. We call the vitreous body. And aqueous humor is a water-like secretion. In the ciliary processes, there is a capillary plexus present. Through the capillary plexus, ultrafiltration occurs, and drop by drop, a fluid is formed and secreted in the posterior chamber of the eye. We call aqueous humor. We maintain the intraocular pressure and also give nutrition to the cornea and other structures. Then there is a question, what is anterior chamber and what is posterior chamber? Anterior chamber is a space between the cornea and the iris. Posterior chamber is the space between the iris and between the lens, between the iris and the vitreous lens. Between the iris and the lens. দেখাবো এখানে। So this is the posterior. So aqueous humor is secreted in the posterior chamber, right? And they comes to the anterior chamber through the pupil. So what communicates anterior chamber and posterior chamber? The aperture in the iris, that is the pupil. So aqueous humor is formed in the posterior chamber, then it having circulation through the posterior chamber, it goes to the anterior chamber between the iris and the cornea. And between the iris and cornea, there is an angle, দেখাবো. It is known as the iridocorneal angle. কি angle? Iridocorneal angle, which is close to the limbus or sclerocorneal junction, inner side of the sclerocorneal junction. So deep to which there lies the canal of Schlemm. So aqueous humor is formed in the posterior chamber, secreted in the posterior chamber, comes in the anterior chamber through the pupil, then goes to the angle and becomes absorbed in the canal of Schlemm and goes to the blood. Circulation goes on. If there is a blockage through this pathway close to the angle, there will be no absorption of the aqueous humor. So fluid will be accumulated in the anterior and posterior chamber of the eyeball, causing pressure, and we call the glaucoma. Glaucoma, closed angle glaucoma. Angle ta closed হয়ে গেছে. or either there is an inflammation of the ciliary body. If there is an excessive secretion, again there is an excessive formation, excessive accumulation of aqueous humor. So again pressure will be rising, and we call open angle glaucoma, which is very dangerous, because if the intraocular pressure increases, it creates a pressure on the optic nerve backwards and the vision may be lost. Right? তাহলে এবার দেখি, তাহলে এইখানে আমরা দেখলাম স্ক্লেরা, কর্নিয়া, আর এইটা হচ্ছে এই 3 ডাইমেনশনাল ফিগারে দেখছো এই যে লিম্বাস বা স্ক্লেরোকর্নিয়াল জাংশন, এই যে স্ক্লেরোকর্নিয়াল জাংশন, স্ক্লেরোকর্নিয়াল জাংশন, স্ক্লেরোকর্নিয়াল জাংশন, এইটা এই সাদাটা হোয়াইটটা, যখন ট্রান্সভার্সলি কেটে বইতে ছবি দেখি দুপাশে দুটো ফুটো দেখি, কিন্তু অ্যাকচুয়ালি ইট লুকস লাইক দ্যাট। আইরিস ইজ অলসো লুক লাইক দ্যাট, এরকম সার্কুলার, কিন্তু যখন ছবি দেখি এরকম, তাই তো? whenever in book iris is looks like that. And মধ্যিখানে centrally there is a pupil aperture, and there is a muscle surrounding the pupil we call constrictor pupil, and peripherally there is a radially arranged muscle, radially arranged muscle we call dilator pupil, which is supplied by the sympathetic nerve. কিন্তু যখন আমরা বইতে 2 ডাইমেনশনাল কাট সেকশন দেখি, আমরা কি দেখি? আইরিসটা হচ্ছে এরকম, তাই তো? এই হচ্ছে কর্নিয়া, এই হচ্ছে লেন্স। অ্যাকচুয়ালি আইরিস কাট সেকশন যখন এদিকে কাটছি, এদিকে একটা আইরিস আসছে, এদিকে একটা আইরিস আসছে, ফলে এরকম লাগছে। এই পিপল, এটা পস্টেরিয়র চেম্বার, এই অ্যান্টেরিয়র চেম্বারে আসছে, অ্যান্ড দিস ইজ দ্য ইরিডিওকর্নিয়াল অ্যাঙ্গেল, এখানে ক্যানাল অফ স্লেম আছে। অ্যাকচুয়ালি ক্যানাল অফ স্লেম কিন্তু এখানটায় রয়েছে, এরম ভাবে ঘুরে। যখন আমরা ডিসেকশন করছি, আমরা এদিকে একটা ক্যানাল, এবার যখন আমরা রাখছি এইদিকে একটা ক্যানাল অফ স্লেম দেখাচ্ছি, কারণ এটা এরম ভাবে কেটেছে। এই আইডিয়াগুলি করতে হবে, রাইট? আচ্ছা, এইটা গেল। এইবারে আরেকটা খুব জিজ্ঞেস করবে, এটা খুঁজতে হবে একটু। এই যে এইটা হচ্ছে অপটিক নার্ভ, ধরেই বুঝতে পারবে। এই যে নার্ভ ফাইবার কাটা গেছে, এই যে অপটিক নার্ভ পস্টেরিয়রলি রয়েছে, এই যে অপটিক নার্ভ, এই যে এই হচ্ছে অপটিক নার্ভ, দেখো কত মোটা নার্ভটা, অপটিক নার্ভ, এই যে অপটিক নার্ভ, দেখি সরো সরো, এই যে অপটিক নার্ভ, এইটা হচ্ছে লিম্বাস বা স্ক্লেরোকর্নিয়াল জাংশন, এটা হচ্ছে কর্নিয়া, এটা হচ্ছে স্ক্লেরা, এইটা হচ্ছে অপটিক নার্ভ, কেমন? আচ্ছা, এরপরে আমরা যেটা দেখাবো কাট সেকশন। এটা হচ্ছে কর্নিয়া, দেখতে পাচ্ছ? এটা হচ্ছে স্ক্লেরা, স্ক্লেরোকর্নিয়াল জাংশন, জাস্ট পস্টেরিয়র টু দ্য স্ক্লেরোকর্নিয়াল জাংশন কাটা গেছে।